Dr. Pratt, I want to ask you a couple questions regarding a breast lift. How does a woman know if she needs a breast lift or not?
Well, I think that's one of the problems. A lot of women who come in and see me don't know. And some of the patients who think they don't need one clearly need one, and some of the patients who think they do need one really don't need one. The two things that you really want to look for is whether your nipple is at the appropriate level on the breast and whether you have a lot of overhang of your breast. And one of the simplest ways to do that is to take a pencil, put it underneath your breast. If it holds, you may need a lift. If it doesn't hold, you're probably more apt to be able to get away with an augmentation.
So where exactly is the incision for breast lift?
Well, there's several different kinds of lifts. We have techniques that we do where we're just elevating the areola position. The areola may be a little bit too low on the breast mount, so we may just take a little crescent of skin out above the areola just to lift it up. For patients who have their nipple a little bit low and a little bit too much skin, we can do what's called a donut lift or donut mastopexy. And then finally, the patients who have a degree of sag to their breast where I need to almost reshape it, and that's the only really true lift, is the lollipop lift or the vertical mastopexy. And that's the scar that goes around the areola and comes down. A lot of patients are very worried about that vertical scar, but I really tell them over the course of several months, by far the majority of patients have a very thin white line there, or a white scar that almost looks like a very faint stretch mark.
So how much lifting can you get with a breast lift?
Well, it depends. Some patients have enough breast tissue natively or just inherently to them where we don't need an implant. We can just tighten the breast, lift up the nipple, and really reshape them to the way they may have looked when they were closer to 18. And with their breast volume there, it gives them a very nice shape and a perkiness. In other patients, they're significantly deflated. We have to tighten the skin, but if we tighten the skin and there was no volume, it would just be essentially a tighter, deflated bag. So the implant is necessary to actually create a shape and stretch out some of that skin that we can't remove just through the lift technique.
So when you do the breast lift, does a patient go usually in the same cup size and fill it better? Do they lose volume? What happens exactly?
Well, a breast lift alone without an implant, we typically let the patient know they can lose up to about a half a cup, because the technique in most cases requires us to remove a little bit of breast tissue in the lower aspect of the breast where the breast is hanging. By removing that breast tissue and removing the skin, we can reshape the breast better. In patients who don't have a lot of breast tissue, we may not take any out, in which case they may not see much of a difference in their size at all.
We talk a lot about, pregnancy, what it does to your breast. Will a lift alone after pregnancy get someone back to that pre-pregnancy look?
That's a hard question to answer. I don't know, what they look like necessarily beforehand. I do know a lot of patients are looking for a fullness to the upper aspect of the breast, a real rounded, youthful shape. And in some cases, a lift alone can't necessarily give you as much fullness on top, and that's where an implant can come in to really augment or really help with the overall result after.
And can you do the augmentation at the same time you do the lift, or is that a separate procedure?
About 80% of the time I do those procedures together. It's in the patients who have larger breasts, C cup, really big C cups, D cups or bigger, in which case there's too much volume that by lifting the breast and putting an implant in, the implant is essentially fighting my ability to tighten the breast and reshape it. And so in those patients, I typically lift them. 3 or 4 months later, I come back and I put an implant in. But in the other patients who are smaller breasted, more deflated, I usually put the implant in at the same time.
And then how long is this procedure?
A breast lift, I usually schedule for about an hour and a half. It's a pretty quick procedure. A breast lift with an implant is closer to about 2.5. But again, that's good for the most aggressive lift. For the lifts that are somewhat in between, the donut or the lips, it's about an hour and a half to 2 hours.
And what's the recovery like?
Similar to breast augmentation in most cases, it's about 4 weeks before you return to your full activities. Most people are back to work over a long weekend, and I similarly have people going back to using a stationary bike and elliptical machine somewhere in between there.
So if someone's wanting to have this done prior to going on a tropical vacation, when can they get in the water? When can they be out in the sun? when is it safe to be in a swimsuit?
Well, I think it's safe to be in a swimsuit almost at any point. I just would like them to use very good SPF block to cover up their incisions. It's about 6 weeks, 5 to 6 weeks before I have patients submerge themselves in water. That's going to be pool water or swimming in the ocean. But what patients don't realize is bathing suits don't always block out the UV light. So it is still very essential long term to put a good block over your incisions, because in the first year, if the UV light does touch your scars or gets exposed there, they can darken.
So what do patients tell you after surgery?
Well, I think most patients are excited about the fact that their breasts look very similar in most cases to the way they were before having kids or weight changes or what have you. The most exciting patients for me are the ones who've never actually had an appropriate shape or a nice, cosmetically appealing shape. You can provide that for them, and they can certainly feel very confident about themselves.